How does advanced imaging predict osteoporosis fracture risk? Imagine a world where doctors can see inside your bones in incredible detail, helping them predict if a fracture might happen before it actually does. That's what advanced imaging technologies are doing for osteoporosis. Instead of just measuring how dense your bones are, these tools look at the tiny structures inside your bones that make them strong or fragile. This is especially important for older adults, where a fracture can mean serious health issues like loss of mobility or independence. Traditional methods like dual-energy X-ray absorptiometry or DXA scans measure bone mineral density. They are useful but don't tell the whole story. Many people with normal bone density still experience fractures, and some with low density do not. Advanced imaging steps in to fill this gap by examining the quality of the bone itself. These methods can visualize the microarchitecture, which includes the arrangement and thickness of the tiny, spongy parts called trabecular bone, as well as the outer, denser cortical bone. High-resolution imaging techniques like high-resolution peripheral quantitative computed tomography, or HR-pQCT, and micromagnetic resonance imaging, or mMRI, allow clinicians to see these microscopic details. They can measure how connected the trabecular network is, how thick the outer shell of the bone is, and how porous the bone tissue might be. These features are crucial because they influence how likely a bone is to break under stress. Artificial intelligence is also making a big difference. By applying AI to standard scans like CTs and X-rays, doctors can generate super-detailed images that reveal subtle changes in bone structure. This helps identify high fracture risk factors such as increased porosity or decreased connectivity that might not be visible with regular imaging. Sometimes, existing X-rays taken for other reasons, like checking the hips or spine, can be analyzed with AI to assess bone quality without needing extra scans or additional radiation exposure. Another innovative tool is the Trabecular Bone Score, or TBS. It works with standard DXA scans to analyze the texture of the bone, giving insight into the microarchitecture that bone density measurements alone can't provide. TBS helps identify people who might be at higher risk of fractures even if their bone density appears normal. These advanced imaging methods are especially valuable for older adults. Early detection of fracture risk allows healthcare providers to recommend targeted treatments, lifestyle changes, or medications to strengthen bones and prevent fractures. Since fractures in older adults often lead to serious complications, improving prediction helps keep seniors healthier and more independent. In summary, advanced imaging predicts osteoporosis fracture risk by offering a detailed view of bone structure, quality, and microarchitecture. These technologies go beyond simple density measurements, providing a fuller picture of bone health. This helps doctors identify those at real risk and take steps to prevent fractures, which is especially vital for maintaining quality of life as we age. Always remember to consult healthcare professionals for personalized advice, as individual health needs can vary widely.